Hey guys, good evening, good evening, good evening. Oh my goodness. It's been so long I forgot how to do this. Welcome listeners. Welcome back to another episode of Health Tea with Dr. B, the MP. All right. I have missed all of you. We have been off the air since January after a much needed hiatus. A lot of good things have happened that I'm completely and honestly thankful for. However, life affects us all, and unfortunately, we had to overcome some trials and tribulations. But now we are back and we are ready to get this thing going. Yes, I'm so happy to see everybody. Oh my goodness. It has been such a long time. But I am thankful that you all are here with us. Hopefully, we can get our reviewers back. But trust me, I am back and we're going to get into some tea. Okay? So before we begin, here is a friendly reminder. If you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and Utah, and you are seeking treatment, the link is in my bio. Okay. If you are ready to reach optimal health, I am right here waiting for you and rooting for you always. Remember that I specialize in PCOS, menopause, functional medicine, weight loss, hormone replacement therapy, and thyroid optimization. And remember, if you would like to be a guest on the show to share your experiences or ask questions, please do not hesitate. Send me a message directly on IG or Facebook, and or send me a message at bit.ly/ health tea with Dr. B. Okay, so today we're going to be diving into a topic that's both personal and pivotal in the world of healthcare. So, embracing new medical opinions without fear and prejudice. Right? You heard that P word. This episode was inspired by a patient's journey and one of my colleagues' stories. They're filled with hope, confusion, and ultimately a clash of medical opinions that left the patients more perplexed than ever. And to add, it left the medical provider perplexed and hurt as well. So we're going to unravel these complexities together. So you already know that I am bringing the tea tonight. All right. And once again, thank you guys for having me again. It's been a pleasure. All right. But first, let's get into this hot tea. Literally. Okay. So here is the tea for the week. And you guys know I always come with my mugs, right? So this week's tea is spearmint tea. All right. It's not like the mint medley that has like a whole bunch of different mints or different tea leaves in it. This is spearmint tea directly. So spearmint tea is basically an aromatic herbal tea made from the leaves of the spearmint plant, known scientifically as the Mentha spicata. So it's known for its refreshing flavor and scent, and it offers various health benefits because I'm only going to drink tea that's going to be good for me and good for you as well. But spearmint tea is also great for specific conditions like PCOS, that is polycystic ovary syndrome. So let's get into these benefits. Digestive health. So spearmint tea is commonly used to help soothe the stomach and relieve any digestive issues such as bloating, indigestion, and nausea. Okay. It's an antispasmodic, so it helps the stomach to relax, you know. So when your stomach starts to spaz up, it can cause cramps and discomfort. So remember, we are in April, which is IBS Awareness Month. So try to have some spearmint tea in your back pocket. Okay. It's also an anti-inflammatory. Okay. It can reduce inflammation in the body, and chronic inflammation is linked to many health conditions, and managing it can improve overall health. But here's why I drink it. I drink it for the hormonal imbalance. So, one of the standout benefits of spearmint tea for women with PCOS is its potential to balance out the hormones, particularly by reducing, that means bringing down the androgen levels, which is testosterone. So, elevated androgen levels are a hallmark of PCOS. That's where you get the facial hair and the acne. And it contributes to such symptoms just like hirsutism, excessive hair growth, and acne. I have been battling this acne for a long, long, long time. And after, of course, getting proper treatment and doing all of my natural remedies, my acne is starting to disappear. Okay. Here's another one. Improved insulin sensitivity. While more research is still needed, Some studies still suggest that natural properties of spearmint may aid in improving insulin sensitivity. Now, I do know that most of your providers do not get an insulin level, but I'm trying to tell you, insulin levels will tell us all that we need to know. So, better insulin levels or better insulin management is crucial for PCOS sufferers, as insulin resistance is commonly associated with that condition, plus more. All right, so I hope you get into this good tea tonight. All right, so remember that is spearmint tea. All right, again, it's good to see you all. So, here's a disclaimer. The content provided in today's session is intended solely for informational purposes and should not be construed as direct medical advice. While I aim to share valuable insights and knowledge, it is important to remember that I am not your primary care doctor. The information shared does not replace professional medical advice, diagnoses, nor treatment. However, if you do have a specific health related question or you're seeking treatment based on the topics that I've discussed, you are encouraged to contact me directly at bit.ly/health tea with Dr. B, or you can consult with your own primary care doctor for personalized medical advice. Your health and well being are completely and truly paramount, and getting advice tailored to your needs from a licensed healthcare professional is always essential. All right, now let's sip, listen, and thrive. All right. So, story time. All right. So, I recently had a colleague who experienced something very interesting. Okay. Um, my colleague experienced a patient who pretty much disrespected her title. My colleague is a nurse practitioner as well. She's been practicing for at least 5 years now. Okay. She's also a functional medicine provider. This patient came to her because she was experiencing hair loss, fatigue, lethargy, weight gain. She was experiencing a lot, and none of her doctors had answers for her. So she found my colleague and said, "Please help me. I hear that you're the best. You do a great job. Please help me." So here's what happened. My colleague helped her, and she couldn't really believe the answers. Um, Not too sure why she didn't want to believe the answers. But she went ahead and took all of the personalized treatment plans that my colleague made for her and went to a specialist. And the specialist actually demanded, I guess, to speak to my colleague to figure out where did such recommendations come from. At the end of the day, the patient ended up saying, "Hey, the endocrinologist or the specialist knows best. So that is what I'm going to go with." However, the patient says, "But I'm still having these issues." So, what is wrong with that picture? It seems like there's a lot wrong with that picture. We have a patient who came to us or came to my colleague because their providers could not find the answers to their issues. However, once the answer came about, they ran from it. Very interesting, right? So it's just things that make you think. So let's think about tonight's title: Soothing the Skeptic, Embracing New Medical Opinions Without Fear, right? There's a lot of fear in that, but we have to understand and be mindful that this is a loaded conversation here. This is completely loaded. I'm not sure if you all follow me on TikTok or Instagram, but I had a reel out the other day, and it spoke about how even myself as a provider, I'm also human, right? I specialize in a number of things that are either considered to be unconventional because it's functional medicine based, but that is not why I receive a lot of the flack that I do get. You know why I receive the flack? Because once they find out that I am African American or my melanin is a bit darker, their ideas tend to change. It's like, "Oh no, we don't know. We would like to go to someone else who has more credentials." Right. So it brings me back to an article that I read. It was written in 2007. And the article mentioned how non Black patients actually expressed that they don't necessarily trust. So they reported low levels of trust and satisfaction with their healthcare provider because they were Black. So they equate race to credentials. Okay. So essentially, we're not winning at all. And even though we are in 2024, these things still happen. This literally just happened to me the other day. I had a patient who came to me, was just gung ho about everything. And I must have sounded different over the phone. But when she finally had a chance to, I guess, see me via telemedicine, she said, well, I'm surprised that you are Black, because Black people don't do this. And it was very interesting because that's what happens. Unfortunately, that is what happens. That is the life of a functional medicine provider who is also African American, Black or brown. Doesn't have to be African American. Okay, so that is what this is all about. How are we able to soothe the skeptic from so many different realms, so many different complexities? Yes, we practice functional medicine, which can be something else in itself, right? But how do we soothe the other part? Is that part just never going to be solved? Impossibly. I don't have the answers to everything. And right now, we're just trying to see what we can do to help. I get patients all the time who are failed by mainstream medicine and they have such mistrust in healthcare. And I understand why. I probably would too. I have stories of my own. They actively seek help, and if they find the right provider, they get all excited, they get everything together, the blood work is together. However, when the treatment plan comes in and it either looks too good to be true or the methods tend to be a bit unconventional, the mistrust comes back. So that is the answer that we are trying to figure out. What happens? What happens once the treatment plan hits the paper? What happens when that ink starts to dry? All right. So, first, let's take it back. Let's take it back to something that's a little safe to talk about, and that's understanding functional medicine. So, functional medicine seeks to identify and address the root causes of disease. So, we are looking at the body as one integrated system rather than a collection of independent organs divided by medical specialties. So, that means, hey, if this is going on, I'm going to send you to GI or pulmonary or GYN. Okay. So, what is the core philosophy? This approach goes beyond treating symptoms to explore the deeper question of why. So, why does this condition exist in the first place? It considers genetic, environmental, and lifestyle factors that can influence long term health. So, in functional medicine, the focus is on patient centered care rather than disease centered treatment. So, this means extensive patient engagement in diagnostics from a detailed history to advanced testing. So, I get patients all the time who do come to see me and they always say, wow, why do you draw so many labs? What's going on? But guess what? Since practicing functional medicine, which has been about a good 2 years that I've been deep into this, I have diagnosed at least 95% cases of PCOS. Okay. I have discovered cancer, thyroid cancers, goiters, Hashimoto, so a ton of autoimmune conditions. And the pattern was this: a lot of these patients have definitely said, hey, there is something wrong. My provider just won't. My provider can't, or they just refuse. I said, okay, well, come over here. And when they get their results, their minds are blown. They're blown because all of these conditions have been sitting here forever. I tell this story all the time about how I have a patient who is maybe 19 years old. She didn't even make 20, but she has an autoimmune condition, Hashimoto's, which means that the body is attacking her thyroid, which is here. Okay. She's had this condition for so long, it's gone untreated that guess what happened? She is now in forced menopause and she's not even 20 yet. So we have to let that sink in. Okay. I usually have to get my inspiration from my patients. That's where I get all this from. When I see that you all are doing so much better from the inside and out, my goal now is to make sure that you feel that way because your health matters as well. This is why I got into functional medicine in the first place. Okay. Functional medicine is unconventional. There's a lot of skepticism about that. So I, I just don't, I get it, but sometimes I don't get it, you know? So let's talk more about functional medicine. All right. So, what is my role as a functional medicine provider? Okay. So, here's what I've done myself. So, back in the day, I used to be known as the patient whisperer. Everyone made fun of me because I can usually tell what's going on with the patient before they tell me. Right. But here is the solid term: we have root cause detectives. So, they used to call me the root cause MP. So, as functional medicine providers, we act like detectives, piecing together clues about your health that can be overlooked in standard care settings. And this is not a dig to mainstream medicine, it's just that the trainings are different. So, we utilize a range of tools from advanced biomarker testing to in depth nutritional assessments to uncover like the subtlest signs of disease precursors. So when I tell people, hey, you're depressed and it's because you have a vitamin D deficiency, they look at me like I'm crazy because they're like, well, why am I on this antidepressant? I say, well, that's my question as well. Because if your vitamin D level is 8 and the total number that you should be is between 60 and 100, then of course you're going to feel depressed, right? But in today's society, we learn or we hear that nutrition kind of falls here. It's not top priority. So when we think about even supplements and vitamins, we don't really take those seriously. We say, oh, that's just diet things. We think about the gym, oh, that's just that. But we never say that this is the forefront of our health, right? So our goal is not to just treat the illness, but to prevent it by managing and mitigating risk factors long before they manifest into a disease. So that's scary for most people because when we think about our grandparents and our great grandparents, what was basically in their medicine cabinets? It was usually what, a whole bunch of pills. It was just a whole bunch of medicine. Like a lot of my great grandparents thrived off of medicine. If it wasn't an aspirin, they don't want to hear anything else. We don't want to hear about a good diet. We want the aspirin. We want our cholesterol medicine. So these are things that are passed down from generation to generation, right? So now when we get new patients and we say, you don't need that medication, right? They're like, what do you mean I don't need medication? It gets tricky. It gets tricky. I have one patient a few months ago who was upset because I wouldn't treat her preventatively for cholesterol, but she wanted medication, but she didn't understand what she was asking for. If I give you this particular medication, it's actually going to hurt you more. It's going to hurt you more than help you. I'm trying to make sure that you don't need it. But again, we have been trained and we live in a society where medicine is at the forefront. Pharmaceuticals, that's what's top here. All right. Our health or holistic health, naturopathic health, that's here. So we have pharmaceuticals, holistic here. So there's a nice imbalance. Okay. So why does skepticism exist? For so many reasons. Okay. So I like to have a joke with a lot of my colleagues and say, providing functional medicine all while being another race that's not favorable. It's like it's hard to say. Sometimes it's hard to think about, but that's just the truth. It exists. It needs to be acknowledged. Now, what can we do about it? Right? The most that I can do is my part. But now I'm just trying to figure out what are other reasons that a patient can be skeptical. So, while functional medicine offers profound insights into different chronic health issues, it often faces skepticism. So, we get a lot of traditional practitioners who may be unfamiliar with the methodology or views holistic approaches as unorthodox. So I have one doctor, cardiologist, top cardiologist, by the way, um, who actually whispered to me. He said, why do you do this particular test? And I said, well, I'm trying to make sure that this person is not at risk for a heart attack. They're 29 years old and their CAC scan, that's a heart scan, showed a 100% blockage. So I just saved this person from having a heart attack. And he whispered to me and said, I would have never done that. He said, because I can't read these tests. So that's the things that they don't let patients know. Sometimes they don't know how to read the test. Again, it's just different training. It's not judging, it's just different training, right? So that's one skepticism. And he was just honest enough to say it to me. Now, was he honest enough to say that to his patient? Or did he tell his patient, don't listen to those functional medicine doctors? They're quacks. Because that's what people always say. Oh, they're quacks, right? So, why would a patient trust us if we have so many other doctors who have great credentials against it, right? Another significant hurdle is the coverage of functional medicine. So, traditional insurance covers traditional treatment plans, right? But when it comes to functional medicine, there may be a higher out of pocket cost for patients, which can engender doubt. So remember, if your insurance is covering your medications and all you have to do is pay $1, maybe $10, but now you're in functional medicine, you now have to pay, let's say, $18 for just one supplement. You're looking at maybe close to $300 or $400 a month, right? So when I thought about it, I said, man, how can I get my patients in? Like, what can I do? You didn't have to think about it. If I'm sitting here and I'm talking about myself, I'm gonna make myself a patient. If I eat out every day and I spend $50 a day, right? I'm going to get more than that $400 or $500 a month, right? I may go out and eat every day. I'm going to be on Amazon, right? I may have to go out so I can enjoy myself. So when you look at it from that perspective, is it really expensive? It's just a lot to think about. But guess what functional medicine does? Ultimately, it saves your money because guess what happens when you get older and you get sick with those same chronic diseases that we're trying to prevent? You go into a nursing home. You know how much that bill is? I have patients now who had to give up their own homes just to be in a nursing home. Imagine that, all that legacy gone down the drain because they are now sick and they just can't. So it's all about how we twist this information, right? It's all about how we twist this information to our patients who are skeptical. It won't work initially, but eventually, once they see how good it makes them feel, then maybe yes. Also, media portrayal can also skew public perception. So sometimes painting functional medicine as just a alternative rather than a legitimate evidence-based approach, that's what makes things a bit tricky. So when I tell people who have PCOS, I say, hey, take this spearmint, take this ovocidol, take this inocidol, take this berberine. They look at me like I'm crazy, but a lot of this is evidence-based practice, which means that it has been peer reviewed, it has been studied, it has been researched. Everything is out there. Okay. I have read probably about 700 articles, probably on hormones alone, to be honest. And the information is out there. Of course, if you can synthesize the information, there's so much out there that we're just missing. So it just breaks my heart to see that there's a lot of skepticism and that there's a lot of people who are sick. Okay. So, what is my goal here? Bridging the gap between functional and mainstream medicine, but also doing this while also being either African American or Black and Brown. Okay. So that's it right there. We need to highlight the need for respect and cooperation amongst different healthcare disciplines. You would never catch me downplaying any other medical provider's treatment plan, right? That is where it needs to start. It has to start at the top. Okay. Patients also can play a critical role by encouraging open communication between their healthcare providers. So, this helps to foster a collaborative treatment environment. So, right now, it's very few providers or very few specialists who will work with me. Like, for instance, you have rheumatologists, endocrinology. I may work with them and they'll say, well, why did you treat this? Or, they actually confirmed a ton of autoimmune conditions for a patient. And they said, but we're not going to treat that patient, so why should you? It was very interesting, by the way. Now, that's the tea. I'm dropping a lot of tea for you guys tonight because I actually have doctors who tell me, yes, we know that this patient is sick, but we're not going to treat that right now. Why would you want to do that? Why would you want a provider who does that? So, when I speak about skepticism, it's so many things behind the scenes that we are just not, or you guys are not aware of. So I cannot say that every functional medicine provider is like myself, but the ones that I know we are. We truly do try to save you from behind the scenes because what happens behind the scenes is a lot of death, a lot of death and dishonor. Okay, a lot of death and dishonor, and it's terrible because again, we are in 2024, so things like this shouldn't happen. Okay, so how can you embrace new medical opinions without fear? So yes, we want you all to advocate for yourselves. I teach everyone, my patients, to advocate for themselves. But sometimes the tricky part is that when they learn how to advocate, they try to advocate against, against me. And okay, that's fine, right? Because you're more comfortable with myself. However, I noticed that because I am African American, Black female, they tend to do that because they think my credentials don't matter or they aren't as high as someone who may come from a higher institution or someone who is non Black. And this isn't a guess or a suggestion or a thought. This is actually what's being said to me. And again, this isn't to cause any controversy. It's just to let people know exactly what's happening. And remember, it's Black Minority Health Awareness Month. So remember, I always got to hold it down. But this is the thing here. We have to call a thing a thing, right? We always have to call a thing a thing. Okay. So it's vital for patients to critically assess medical opinions while remaining open to new ideas. The problem is that we have to understand that one size does not fit all in medicine is key. Like how I treat this person or how this one person is being treated is not going to be the same way that you're treated. So we play that fairness and equality part. We play that a lot. But again, you are your own person. So that's why when patients come to me, it's never, hey, I'm normal, because no one is normal here. I don't even know what normal means. It's normal versus optimal. How do you feel? You are your own person, right? I encourage people to get second opinions. Seeking second opinions, especially when the diagnoses or treatments differ significantly, is not only advisable, it's a right for every patient to hold. So, by any means, I am not saying that you are not supposed to get a second opinion once you see a functional medicine provider. You just have to understand that the trainings are different. If I tell you, hey, you're going to have to take vitamin B12, and your doctor says, no, you don't have it, which one do you want to fall in line with? Is it going to be A or B? Because now I hope that you have been empowered to make that decision because ultimately it's how you feel is what your gut says. So ultimately, if you go with your doctor's recommendation, just remember why you stumbled over into functional medicine in the first place. Okay? Because what's key here is that empowering patients through education about their health conditions and treatment options is extremely fundamental to fostering trust and confidence in their healthcare decisions, right? That's what that means. As long as I know that I've educated you to the best of my ability, I want you to be able to make that decision. So when patients ask me, what should I do, Dr. B? What should I do, Dr. B? What do you want to do? Because again, this is not a one size fit all approach. How do you feel about it? If your gut says go here, then guess what? I'm going to root for you all the way. Okay. So, how else can we stop the criticism or the skepticism? We have to address these conversations directly, which was the reason for this podcast. My colleague actually inspired this podcast because I didn't like what she went through. And the behind the scenes of functional medicine is so grand and so specific that it takes so much time for us to say, wow, this person has this and this going on. So sometimes it's a slap in the face when someone then seeks a third or fourth opinion, but not because of that. It's when they come back to say, hey, I wanted to talk to somebody who was much more qualified than you, right? That's where the issues come in, right? So that provider was left to feel hurt and also confused because she thought she was helping. Because again, when you go to see a functional medicine provider, no one wakes up to say, let's go see a functional medicine provider. No one ever says that, and ever. They say that when they have been sick for a long time or because they feel different and they need help and they feel like they're not getting help. That is when people come to see us. Okay? So just think about that. The next time you visit a functional medicine provider who happens to also be Black, African American, Hispanic, so again, Black and brown. Okay? Remember that healthcare is going to forever evolve. So, in the future, we always are going to include innovative, patient centered, and integrative approaches that respect and utilize the best of all medical fields. So, even though I practice functional medicine, I'm very well versed in mainstream medicine. So, I get both sides. It's just how we approach certain things is just different. So, what do I hope for tonight? I hope for you all to kind of sit and think about your skepticisms. Think about your own health. Have you not been listened to? Is it time for you to seek a new provider? Is it time for you to advocate? Because speaking up for yourself can be one of the most difficult things to do ever. Okay. If you guys were here from my very first podcast, remember I was inspired by all of you. All my patients inspired these podcasts because there were so many voices who they never had a chance to be heard because ultimately they passed on, and they passed on without being able to express themselves about their health. I never want anyone to feel like that ever. Okay. So as you all start to delve into advocacy and finding what works for you, I want you to explore why new medical opinions, especially those from the realm of functional medicine, should be considered thoughtfully and without fear. Okay? When you're thinking about that, think about the foundation. The foundation is yourself. All right? And if you guys were here for my podcast back in November, remember, I want you to consider yourself as a teacup. So this is my teacup. You guys know orange is my favorite color, right? So orange is my cup here. This is my teacup. It's beautiful, right? But this is how I see myself. If you see yourself as a cracked cup, how can we fix you again? How can you fix yourself? So you have to think about it in these regards. All right. So for tonight, I hope that I did a little something. It's something very different. I usually always talk about a health condition, right? I always talk about a health condition, but tonight I wanted to give you all a different kind of tease because I wanted you all to really understand what functional medicine providers go through, how hard it is to navigate treating a patient, but how hard it is to treat patients when the patient doesn't respect your credentials because of the color of your skin. So it's a lot. I didn't quite answer that part because I can't answer it myself. I'm still learning, right? But okay, guys, that is Health Tea with Dr. B. Thank you all for joining me tonight. I see a lot of you guys on Instagram. Thank you all for joining. I really do appreciate it. I will see you all in 2 weeks. We are going to be discussing gut health. And just remember, if you guys are looking for a provider or you just need help, please don't be shy. Honestly, just send me a DM. We answer. Thank you all for supporting. Please follow us on Facebook, Instagram, YouTube, and TikTok. I'm over there too. I would greatly appreciate it. So thank you all. Have a good night. All right, guys. Bye.